Welcome to my channel. This video is called How Not to Die from COVID-19. If you already are in the hospital, this may not be the video for you. If you make it home, then you can take these practices and incorporate them into your life, and maybe you won't have to see those medical non-experts again. Let's begin. A lot of advice to stop the spread of the virus is what? To wear respirators, masks, wash your hands, social distancing, because supposedly the virus is airborne. That's comical in itself. So we got to discuss germs, which are bacteria, pathogens, antigens, whatever you want to call them, and then we got to discuss viruses in the external environment. Because if these things could actually cause disease, there wouldn't be a soul left on the planet. Now, people want to be Robert Koch, Walter Reed so bad. They want to discover an unexplained disease. Then they want to find a virus or some type of germ or microbe for it, so they can come up with a cure or a vaccine and be a legend like these dudes. So this is where all the germ causing disease and the virus hunt for disease all begin right here with this model.
This is Anthony Van Leeuwenhoek, a Dutch janitor. He used to construct microscopes on his spare time. So one day he found bacteria in saliva. The tiny creatures existed not only in the bodies of humans and animals, but even in the waters of rivers and lakes, as we know today. Leeuwenhoek's discovery did attract the attention of established scientists at the time, but he never supposed that the bacteria caused disease or he just considered them mere curiosities. He didn't have any reason to blame them for the disease because no logical rule yet existed for proving such an idea was true. Now, Leeuwenhoek's discovery did give birth to the germ theory of disease, right? Now, here's the French chemistry professor Louis Pasteur. So what Pasteur is known for pasteurizing your milk and your orange juice, heating it up, removing the microbes and bacteria from it. So how his career got started. He learned through his experiments that yeast and microbial type of fungus was the organism making the alcohol, and the bacteria could prevent the fermentation as well as cause contaminated food to decompose. Physicians and scientists throughout Europe soon made the logical connection with the disease that such germs might cause sickness, and this became widespread and a topic of discussion amongst that scientific community. Now we got the German doctor Robert Koch, which you see in his laboratory. So you always hear me talk about Koch postulates, and I'm going to explain Koch postulates right now. First, the germ must be found growing abundantly in every patient and every diseased tissue. Second, the germ must be isolated and grown into a laboratory. Third, the purified germ must cause the disease again in another host. So let's talk a little bit about Robert Koch's career so you can be familiar. Now, Koch wanted to prove that microbes could spread disease, so he was forced to find a way to grow the bacteria under his microscope, right? So he grew some bacteria and eye fluid from slaughtered cows to quickly prove its part. So Koch then inoculated some mice, and he seen that them two became sick, right? Now he the first person to meet the criteria of Edwin Clabbs. However, the anthrax bacteria was large and it was easy to isolate, and they usually cause disease in animals rather than disease in humans. So next, his growing interest in the subject of human disease. So now he's gonna start his work with the study of open wounds and infections. Observing the samples from various animals and people, he reported that the bacteria could hardly be found in healthy organisms, while they were abundant in the blood of diseased animals. So his results led him to add now a third and key condition, which is the third Koch postulate that I mentioned earlier during the presentation. So now he's faced with this problem, because a microbe cannot scientifically be proven guilty of causing the disease unless every diseased individual has a large amount of the germ growing in the damaged tissues of the body. So, meeting such standards of proof lay in the difficulty of culturing pure preparations of any given bacteria species. So this is how the petri dish came up. He came up with a new method and a new technique to pure culture the bacteria. Now he got the experiment and logic in place. Now this new method is like a mixed blessing, and his followers, started claiming bacteria causes of non-bacterial, non-infectious diseases without even checking the titer of the number of bacteria in these diseases. Many of these putative microbial pathogens later proved to be harmless passenger microbes, normal parasites of healthy and ill people when subject to his postulates for criteria to distinguish harmless from pathogenic microbes. Now Koch started focusing his attention on tuberculosis. Now he proved all three of his postulates with tuberculosis, right? Now, buku other scientists and doctors decided to jump on the bandwagon, and then this shit led to some sloppy mistakes. Now scientists and doctors are discovering all kind of new diseases, and they blaming it prematurely on the bacteria, and they not even satisfying the Koch postulates. Koch himself was also guilty for this type of error. In this study of cholera, he isolated the correct bacterium, right? But he couldn't find an animal that would become sick when injected with the microbe. But he still declared the cause of cholera by using statistical correlations rather than testing other animal species to meet his third postulate.
So now we know that germs is not infectious and they don't cause disease. The reason why you can find people with the same type of illnesses is because of the same type of living. They're doing the same thing. So you remember we used to say that I'm fat because of genes, or I have this disease because of genes, when actually diseases causes through genes are a very, very small percentage, right? And here's why you cannot transfer one disease to another person, because my immune system is my immune system, your immune system is your immune system. The reason why I can have heart disease and you can have heart disease and we can't transfer it to each other is because we're doing the same things that cause heart disease. So it's the same thing. So if you're fat and a lot of other people are fat in your family, it's because y'all doing the same stuff. Y'all don't exercise and y'all eat unhealthy. So it leads to y'all being fat. So the germ theory of disease fell off, and all those scientists or doctors, they lost what? There's no work for them. So now they gotta hop on another bandwagon. And especially today, we know that we have more bacteria in our body than cells. There's harmful bacteria in the gut, and there's good bacteria in the gut. And depending on which one populates the intestines depends on your diet and how you feed yourself. So we'll talk a little bit about that later. Not to mention, another blow to them, they were still trying to prove bacteria cause the disease, and later that they was finding out that it was vitamin deficiency. Like in my last video, how to eat to build good health, you can see where I was explaining vitamin deficiencies causing disease. Now we're dealing with viruses who are not living organisms like bacteria. Viruses need cells to grow. It replicates inside the cell by tricking the cell to make more particles. But viruses, they lay inactive inside of these cells. They cannot really do no damage unless the immune system is compromised. So if the immune system is compromised, then you will start to see symptoms. which is which I told you is a expression of detoxing. So virologists get on this big cancer causing thing. HPV causes cancer, cervical cancer, and they say all these things come from viruses. The problem is with that, cancer is not contagious. Viruses use living cells, they replicate, and then it ends with the disintegration of the dead cell. So the virus is gone. Cancer is living cells. They don't mix together. They're doing two completely opposite things. So the theory is false. Now the virology science community has become about fame, grants, and money. And that's who they cater to. It's no longer about the science. And basically, anything that is said, the media and the public will believe, just like what's going on now. And they continue to manipulate the public due to our ignorance of retrovirus and viruses in nature that only can do harm if, even with wild animals, if natural immunity is lost. So the immune system has to be totally destroyed for bacteria or viruses to cause sickness. Let's talk about inflammation, which is non-specific resistance. It's an immune response to tissue damage. It removes the toxin, foreign pathogens. It prevents it from spreading to other tissue, and it is also a healing process. Let's take a look at this video so I can explain it in detail a little bit deeper.
The three stages of inflammation are vasodilation, increased permeability of blood vessels, phagocyte immigration, and tissue repair. What you see right here is the dilation of the arterioles and the increased permeability of the capillaries, which produce three different symptoms. That's inflammation, that's heat, that's redness, and swelling. Pain is a primary symptom of inflammation. It results from injury to the neurons and from the toxic chemicals being released by the microbes, and the tendons affect some nerve endings. The increased permeability of the capillaries allow leakage of blood clotting factors into the tissues. Within an hour after the inflammatory process starts, phagocytes appear on the scene. As large amounts of blood accumulate, neutrophils begin to stick into the inner surface of the endothelium lining of the blood vessels. Then the neutrophils begin to squeeze through the wall of the blood vessels to reach the damaged area. This process is called immigration. Depends on chemotaxis, right? Neutrophils attempt to destroy the invading microbes, as you see it doing here, and a steady stream of neutrophils ensured by the production and release of additional cells from the red bone marrow.
Now, beyond acute inflammation, which is healing, there's chronic inflammation, which is long-term. It's consistent over months and years, and there are several causes for this. Some are diet related, and before we get to diet related things that cause inflammation, we have to deal with psychological, emotional, and physical things such as stress and depression that causes inflammation. And inflammation also can cause depression and stress, so there's a feedback loop between the two that the body responds to. We're in a situation to where we're in a state of fear, panic, unknown. People have lost their jobs. People are threatened to lose their homes. Some people have lost their homes. The future doesn't look promising right now. They want you to stay inside. Just a lack of sunlight leads to depression. Anybody, you know this for yourself. You sit in the home, if there's no light coming into the home, if there's curtains closed, there's dark, and those type of people that be in the house have very nasty attitudes. People who are more vibrant, people who be in the sun, you can see they're always more lively. You know what I'm saying? So dark households, dark places, places where the sun don't shine much lead to depression. People have lost their money. People are stressed. So this causes chronic inflammation. Besides the dietary causes of chronic inflammation, such as food, the acids in meats, the fats in meats, the bacteria in meats that break down causes inflammation. Seafood causes inflammation. So we're eating a diet that causes inflammation. Cooked food actually also has an immune response by the white blood cells. So the problem with inflammation is it leads to an immune response, and the body, the cells start to even attack healthy tissue. So what does this has to do with COVID-19? Inflammation. It is creating a cytokine storm. So what are cytokines? So cytokines are small protein hormones that inhibit or contribute to normal cell functions, and they're involved heavily in immune responses. So a lot of the doctors in the Wuhan area reported patients with severe COVID-19 also had the cytokine storm immune response. Now, this is not the first time that scientists suspected cytokine storms as the cause of death, and this is actually the cause of death and not the COVID virus, because as I said before, a virus cannot take you out. Your immune system is too strong for this kind of things. The flu pandemic and the SARS pandemic were actually, those deaths were actually contributed by the cytokine storm, the immune system attacking itself in healthy tissue. So let's look at the link between the cytokine storm and inflammation, and how inflammation causes the cytokine storm. Acute inflammation response is also marked by the activation of pro-inflammatory cytokines, chemokines, right? The pro-inflammatory cytokines or chemokines can lead to the recruitment of inflammatory cells. Then an increased expression of inflammatory, antiviral, and apoptic genes occurs, accompanied by abundant immune cell infiltration and tissue damage. At the same time, regenerative process and resolution of the damage are initiated. In most cases, function can be completely restored by this reparative process. However, for severe inflammation associated with cytokine storm, more serious pathological changes are observed, such as diffuse alveolar damage, hyaline membrane formation, fibrin uridates, and fibrotic healing. These are signs of severe capillary damage, immunopathological injury, and persistent organ dysfunction. Now we know that inflammation leads to the cytokine storm, and we have to live a lifestyle that's not pro-inflammatory. We really need to take our nutrition more serious and our lifestyles more serious. And let's recap over the things that cause inflammation besides physical wound. There's depression, there's stress, leads to inflammation, and then we have the dietary cause, which are all meats, all seafoods, and cooked food. That's why I push a majority raw diet or fruit-based diet, which are all anti-inflammatory foods when you're dealing with fruits and raw plants. leading majority towards a fruit-based diet, meaning more fruits than plants. The healing point of all disease begins with the blood. So even if you have a okay diet, you're moderate in other things, right? And let's say your blood is not pure, your blood is toxic, then the waste that comes from the cell can also repoison you. I already spoke about in my last video how the cells secrete viruses. And when the cell waste is not getting out the body through the channels of exhaling, the lungs, the urinary, the skin, the mouth, all the channels that we get viruses out, then it will repoison the body, and there will be immune response every time. So nutrition, this has to be preventative. We can't expect doctors to deal with this when they get to the hospital. Your health is in your own hands, so you need to make those changes today. Another cause, extreme exercise is also pro-inflammatory because it leads to oxidative stress. It produces too many free radicals. So exercise also needs to be moderate. You know, I don't suggest running. I always suggest walking. I suggest light exercise, not all this crazy shit that's going on now because it's pro-inflammatory. And this is the wrap up of this segment, how not to die from COVID-19.